Hello guys, I'm Dr. Hrithik, emergency general physician. Welcome to HK Professional Health and Education channel. Okay, today we discuss about after auscultation of the heart sounds. Okay, please listen carefully. It is very important for examination of the heart patient. Okay, first we observe, find out the patient using stethoscope, diaphragm. These are five location of the auscultation of the heart. Right side aortic, pulmonary, half point, mitral, tricuspid and mitral valve of the heart. Okay. First aortic, pulmonary, half point, tricuspid and mitral valve. Okay. These five location of the examination of the heart patient. Okay. In aortic region, if it is noticed abnormal means some aortic stenosis condition of the patient. Okay. And some in mitral region, base of the heart. Okay, in anatomical condition, base of the heart, mitral condition, you notice some murmur or sound. It may be chances of mitral stenosis means abnormal calcification value of the accumulation of the heart. Okay, these are four heart sounds basically. Okay, first S1, S2, S3 and S4. Okay, in normal patient we observe clearly S1 and S2 heart sound. Okay, lab dub. Okay, in S3 it is some heart stenosis, aortic regurgitation. It is noticed in after completion of S2. Okay, suddenly in during frequency we notice S2, S3 heart sound. In time of S2 after completion of S2 heart sound. Okay, and S4 we notice after start point in during heart sound in carefully observing in during S1 heart sound. Okay, it is severe condition. Only some patient we observe the S3 and S4 type of heart sound of the patient. Okay, it's very examination of the patient to analyze the some aortic stenosis, mitral stenosis, some any other cardiac issues of the patient. Okay, carefully please listen, low pitched voice, observe clearly. Okay, today topic is for meteorological biology.